today first time. We are doing cupping for cervical spondylosis. This is our patient. He's having cervical spondylosis. He doesn't have movement on his left side. He can't go side flexion. And we did cupping last month. Now we are doing again. And in between, we have done some shock wave therapy with our. We are doing shock wave as well. So that helped us till some extent, but still we are in the middle. We have not yet got 100% result, but yes, we are satisfied with the results till now because the patient is suffering from last 30 years. As you can see now, we are doing cleaning. This is a disinfectant which we are using. So before doing hijama or cupping, it is very important to clean skin, disinfectant it, and make sure everything should be sterile, whatever you use, whether it should be cotton gloves or gun or cups, especially for cups, they that should be sterile, right? So as you are watching, we are trying to clean his skin with different kind of solutions. First I did clean with the Savlon, then followed by I cleaned by betadine, and then now I was cleaning with separate. As I would like people to comment and ask questions so that we can live solve your queries on the same at the same time. So today I'm just going to bit different. I never used cup on the sides, which I never do in my protocol. But this patient is very different. That's why I'm going a little, differently for this patient. I'm breaking my protocol for this patient. Normally we never use cup on this sides because I know this patient now. It's been a month, so I know his muscle tightness, his involvement of muscles and other tissues. So that's one. That is how I'm doing today. So just we are just going to start putting my first cup. So no movement now any. Maybe sometime we may we may need to use some vacuum machine because sometimes patient doesn't get exact vacuum with the gun. So it's very different today what we are doing. I would like to see patient how we do it. See, we are losing vacuum in some cups. So what I'll do, I'll see which cup is getting proper pressure. There is some issue with that cups now. Either so it's better to use vacuum. Sometimes these cups doesn't make. So this is how. Now we have to wait for few minutes, not more than that. We are just will wait for few minutes, not uh, we have to wait for only for few minutes because we are going to give very minute incisions, which will fade within 10 to 15 days. This uh, we have 1, 2, 3, 4, 5, 6, 7, 8, 9, 9. Yes. As we have to wait for few minutes. See, this is my the new blade, oil blade. Now we are going to give. I have to keep this cup inside my tray. Can you come close, little close, so that people can see how I do? See, we have done with this cup. Now we are going to create vacuum again. This is the next cup where we are going now. See how I do. It's just kissing of a blade. Very minute cuts. Just like I'm scratching on the skin. It's very small and minute, as you can see. One is one egg. One is okay. Now we are going to make incision for this cup. As you can see how I'm making incision. These are very precise and small and same cut, same incisions, same size, everything is same in a very manual way. As you can see, it is in a same line and same size of cut. You can see how it is oozing blood, how blood is oozing out. So these are very minute, even you can't see cut here that much of, until unless I'm not making a vacuum. Yes, sir. Blood is coming out. We are live today, sir, on YouTube. This is our first live video. See, as you can see how blood is coming out. Now we are going on a very crucial point. It's very important to have very good incision here. Just only focus on this point. Just want to see people watch this point. It looks easy, but I must tell you, on neck it is not easy as it looks. We have to be very careful here. Here is a bit tricky to make incision because even I'm not getting full window here. Okay, we're done. So we are done with the incisions. Now we have to watch. Watch. I may need some cotton. See, as you can see, we're getting very good. Now every cup is almost full. We are here, sir. No, because the limitation of blood, I believe, is enough. We got good blood in every cup, so we have to restrain. Vacuum, where? नहीं ठीक है. So there is some issue with this cup. So what I have to do? I have to create make less continue vacuum. So it should be six around 6 pascals vacuum of the cup, not more than that. See, as you can see, we got a full cup. In each and every is a full cup. Even on the neck, we got very good blood. And I can't touch anything because I'm having sterile gloves in my hands. So I have to be very careful. I can't touch anything. Whatever I touch, it should be sterile. I can't touch which is not sterile. So these pipes, all everything we keep in a sterile manner. We keep in a UV chamber, so that is how we do it. We have to wait before removing these cups. We cannot remove these cups until we will touch it like this. If we think yes, it is getting clogged, then we can remove. Before that, we cannot remove these cups. Hope everyone is enjoying this video. This is just for educational purpose and for the people who are scared of the cupping hijama. So I just want to show them. See, there is no pain, nothing else. It is just a minor pinch feeling while doing those incisions on those spots. So this is our second session. Earlier, the patient has done one session, and this is within 1 month. He came for the another session, and in between this, we gave him a shock wave. That is one of the latest machine in India available for to decrease the stiffness, muscular stiffness, to release muscles. Where there is a tendonitis, it helps in tendonitis, heel spur, tennis elbow, golfer's elbow, even in neck pain, cervical spondylitis, cervical spondylosis. So, but we have a limitation as well. But this patient is suffering from last 30 years. He has been gone through medical practitioners, but didn't get any relief yet. But and after doing vigorous sessions with us, he felt around 90% of neck is movable. 90, not 100 yet. But we are doing still. We are on the work. It will take time because he's having pain since 30 years. So anyone wants to ask any question, so please you can ask question so we can answer. David, we do cupping for hair fall. We do cupping for insomnia. We do cupping for depression, and we do this cupping for migraine on the head. And apart from that, we do it for cervical spondylitis, cervical spondylosis. But still, after that cupping, you should not, only think the cupping will help you 100%. After that, you should work on your gross root level. That will help you only in pain management. After that, you should go for a proper exercise, strengthening, proper diet, proper ergonomics, how to sit, how to stand at your office, at home, and we can go for like people come for fatty liver, heart problems. But we can only have not, we cannot assure 100% we will cure you from the problem. Like we can improve the blood circulation, we can help you boost your immunity. We do it for immunity, for sciatic pain, back pain. We can do it for erectile dysfunction, premature ejaculation, infertility, and much more. If somebody is having questions, please ask us. So we are live. We will be very great if somebody is having question. We can answer you right away. So keep watching. You are watching our channel. Sports Physiotherapy and Vet Coming. We are live from Delhi, Saket. See, this is the winter time, and we have to make sure patient should be warm. So we have to keep here blower or room heater, whatever. It should This room should be hygienic. We have to go for every once or twice in a week. We do some sterilization that we keep here. And apart from that, we keep here all the time. Heating system should be good in winters. In summers, we don't want air, like fan, direct fan. We use AC in this room where we get mild cooling effect. Not We do not want exactly that AC effect here. And but in winters, we want to be this room should be warm enough. Otherwise, body the muscles will get contract. We cannot get enough blood whatever we want. So see, these cups are full. No, we have to wait until we are going to remove these cups. This is it for the day, and I must apologize. We cannot continue this video because of some our technical team is not ready. But this was our first video, and we are very pleased to announce that we have made a wonderful video for the first time, a live video on the cupping for the cervical spondylitis. But this patient is having multiple problems, so that is why we put some cups here and there as well. So thanks, guys. Thanks everyone whosoever watching this video, and will be very great. Please like and subscribe channel. But I just want to share a few more things before we'll make end of this video. What I'll do now after that, I will keep some cotton here. We will remove a cup, and then we will clean off, and then we will put same cup again. If we get some blood again, and we will wait. But if there's a serum, then we will just remove that cup. So thank you for watching. Please like and subscribe. Thank you for watching. Uh, if somebody is having question, please ask us. This is our first video actually live. We are not so technical yet, but we are learning. Uh, we want blessings from each of everyone who is watching this live video. Help us to share this video so that as many as patient people watch this video. This is just for educational purpose. Please don't try this at home without any proper guidance. And it's only a medical professional should intervene this kind of a thing. So please avoid to do this at home. I'm actually sharing on one of my patient has requested me to show us live because normally we make video clips, then we add those clips together and make a video. But we he just told me to show see go for live one so that people will see how we do a proper course of treatment. So this was our full flushed. There were no hidden or anything. Everything was live today. So I am also tired, bit of a tired, speaking a lot. I may need some water, but I can't have water because these are all sterile. So I may take a leave. Thank you for watching our video. Thank you. Thanks. Thanks.